testing centers and labs are overwhelmed by the sheer number of people seeking out those PCR tests. Well, today, Ontario's top doctor has released new testing rules and self-isolation requirements. So here's a look at what was announced just a couple of hours ago.
The Omicron variant is rapidly spreading, and we must preserve these resources for those who need them the most.
As daily case counts continue to soar, the number of infections is likely 5 to 8 times higher than what's being reported due to an overwhelmed testing system. This is what our cameras have captured over the last couple of weeks. People with symptoms or close contact exposures lining up in the cold for hours. Was it hard to find a test?
Yes, it was actually very hard.
It's like literally I had to plead with somebody just now at a pharmacy saying, please, can you just try and take me in? Because he's just not well.
And now starting tomorrow, the eligibility for PCR tests will narrow significantly.
Beginning tomorrow, December 31st, publicly funded PCR testing will only be available for those vulnerable individuals, including those with significant medical issues who are symptomatic or at risk of severe disease from COVID-19. Including for the purposes of confirming a COVID diagnosis prior to beginning treatments, and workers, residents, and others in the highest risk settings, such as hospitals, long-term care, retirement homes, and congregate living settings.
And if you test positive on a rapid antigen test, you no longer need a PCR for confirmation. If you develop symptoms and are not eligible or do not have access to a test, Ontario's top doctor says assume you have Omicron and quarantine. The isolation period is also being adjusted following new guidance from the CDC. Dr. Moore says there is growing evidence that people are most contagious 2 days before symptoms and 3 days after.
Individuals who are vaccinated, as well as children under 12, will be required to isolate for 5 days following the onset of symptoms. This also applies to their immediate household contacts. The isolation can end after 5 days if symptoms are resolved or improving for at least 24 hours, and all public health and safety measures such as masking and physical distancing are followed.
Now, the 10 days of isolation still applies to those who are immunocompromised, unvaccinated, or partially vaccinated, and the guidance is slightly different for healthcare workers. There really is a lot to unpack here, so everything you need to know is now posted on our website, citynews.ca.